السلام عليكم.
وعليكم السلام دكتور.
مساء الخير يا شباب، شلونكم حيين؟
عليكم السلام دكتور.
الحمد لله بخير.
شلون المعنويات زينة؟
ايه ان شاء الله زينة.
توكلوا على الله. نبلش مع نبأ وتقوى وريم ان شاء الله.
ايه ان شاء الله دكتور. ايه
يلا حبيباتي توكلوا على الله.
تمام دكتور. بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. اليوم السمنار عندنا بعنوان Gastrointestinal Manifestation in COVID-19، يعني المشاكل اللي يسببها كورونا فيروس في الجهاز الهضمي. Introduction. We all know about the coronavirus disease. It is respiratory illness caused by the severe acute respiratory syndrome coronavirus 2. The abbreviation of it is SARS-CoV-2. It has public health emergency classified as pandemic. We know pandemic, it is a disease that spread in countries and continents, and the World Health Organization in March 2020 it is classified as pandemic. معناته أنه شخصوا كورونا على أنه مرض وبائي. Although primary respiratory disease growing evidence show that it affects the digestive system and present with various system. يعني أنه ما بس يأثر على respiratory بل يأثر على digestive، ويسبب عدة مشاكل مثل أنوركسيا، diarrhea, nausea, vomiting. Nutrition societies have recently published their guidelines in the context of the pandemic and several points emphasis يعني أكدت الرول of gastroenterology in nutrition therapy. يعني كل الأبحاث العلمية والغذائية أكدت تأثير كورونا فيروس على العلاجات مثل nutrition therapy. SARS-CoV-2 is pathogen responsible for COVID-19. هو هذا الباثوجين of corona. It's a novel إنه هو يعني غير شائع enveloped RNA bacteriovirus that attached to the angiotensin converting enzyme 2. يعني الباثوجين مال كورونا راح يعمل attach للأنجيوتنسين converting enzyme 2. هاي الريسبترات الموجودة حتى يسمح entry into the target cell and facilitate replication. فهاي الريسبترات راح تكون أكثر شيء موجودة بالريسبيراتوري وهم موجودة بالdigestive system و specifically in enterocyte lining of the ileum and colon. فالattachment of the SARS-CoV-2 virus of the angiotensin converting enzyme 2 receptor of the digestive system is believed to disrupt the normal intestinal flora leading to different GIT symptoms. يعني إنه ارتباط الباثوجين of كورونا على هاي الريسبترات الموجودة بالريسبيراتوري وبالدايجستيف راح تحفز أو يعني تشجع النورمال فلورا حتى تعمل different symptom مثلا الدياريا. وأيضا أكو بعض الأدلة تثبت إنه السارس كوفي 2 RNA حتى موجود بالفيسز supporting it is a pathologic mechanism in the gut. هاي صورة تبين الباثوجين of coronavirus عشان تجي تعمل attached على هذه الانجيوتنسين converting enzyme، ومن يصير attached راح تدخل على السيل ممبرين، بالسيل ممبرين يصير attached وبس تدخل راح تصيغ الانفكشن. possible mechanism for GIT manifestation predictive model for gastrointestinal GIT، يعني إنه هاي طريقة محتملة وليست أكيدة، لأنه مثل ما نعرف إنه هذا المرض إلى حد الآن هو يعني الأبحاث عليه محدودة تقريبا. هاي ACE2 اللي هي الريسبترات expression and stronger binding of SARS-CoV-2 for angiotensin converting enzyme is absorptive intestinal epithelial cell in the ileum and colon. يعني إنه في حال صار أكو high expression يعني كلش راح يصير أكو ارتباطات قوية و stronger binding ما بين ال pathogen of corona وما بين ال angiotensin converting enzyme. هاي راح تحفز على ال inflammation يعني هي راح regulate intestinal inflammation and esophageal erosion, suggested the viral invasion to enterocyte of the digestive tract. The high expression of the gastric expression of angiotensin converting enzyme in the glandular cell of the gastric and duodenal epithelium or proximal intestinal enterocyte همين راح تؤدي إلى unbalanced intestinal secretion and malabsorption. يعني كل هاي الهاي expression والبايندينج الكلش قوي بين هذول الباثوجين وبين الانجيوتنسين converting enzyme راح يؤدي إلى عدم توازن في الإفراز والامتصاص فيؤدي إلى malabsorption. فهذا الشيء أكيد راح يسبب دياريا، والدياريا هي راح تكون الكومن GIT manifestation. Abundant and ubiquitous presence of angiotensin converting enzyme to in human epithelium راح تكون موجودة بالsmall intestine and endothelial cell. هاي هي might provide possible route of transmission accounting for high transmission capacity. يعني وجود هاي الانجيوتنسين converting enzyme هي اللي راح تسمح ب possible route of transmission. هاي هي الميكانيزم المحتملة لنقل أو للإصابة بال GIT manifestation بالكوفيد. هذا فيجر يوضح الميكانيزم اللي هسه شرحناها. إنه هي هاي الأمعاء الانتروسايت والجلوبال سيل راح تحتوي على angiotensin converting enzyme inhibitor موجودة بالهذا الانتستينال epithelial cell. يجي SARS CoV-2 راح يصير اكو attached راح يصير binding فراح يصير infected enterocyte فبالتالي راح تسبب esophagus erosion تسبب diarrhea و unbalanced intestinal secretion of malabsorption وهذا الشيء كله يؤدي إلى diarrhea وتسبب عدة المشاكل اللي هسه راح نحكي عنها إن شاء الله واللي راح تكملها زميلتي نبا اللي هي الأعراض والسيمتوم اللي تسببها هاي الانفكشن.
السلام عليكم. نبلش بالgastrointestinal manifestation of COVID-19. السيمتوم GIT manifestation are responsible or reported in 11.4 to 61.1% of individual. The majority of COVID-19 associated GIT symptoms are mild and self-limited يعني لحد الآن هي يعني mild تكون يعني محدودة and include anorexia, diarrhea, nausea, vomiting, abdominal pain, discomfort. In some studies, anorexia and diarrhea were the most common GIT symptom, while the others, nausea and vomiting, were more prominent وتكون أكثر شيء بالفيميل. النسبة 65.7% تقدر لل 51.1%. Next. هذه السيمتوم figure لل GIT manifestation in details. Next على السلايد اللي بعده. هسه نجي على symptom in details. Nausea and vomiting. إنه pathologists found high level of nausea and vomiting following COVID-19, while the incidence was lower in most other studies. A higher incidence of nausea was associated with more severe disease. نحن ذكرنا إنه nausea and vomiting تكون ما كلش أعراض قوية بالكوفيد-19. Patients presenting with nausea and vomiting with diarrhea are more likely to have fever than those having the symptom alone. يعني إنه البيشنت اللي هم عندهم COVID-19 عندهم vomiting diarrhea وعندهم النوزيا 3 symptom together مع بعضها يكونون أكثر يعني معرضين للفيفر أكثر من ما تكون إن هي one symptom alone مثل النوزيا أو vomiting يعني تكون alone. Neonates with COVID-19 had vomiting and milk refusal associated with the respiratory symptom إنه يعني يحدث عندهم يعني قيء وإنه ما يتقبلون الحليب من mother's breast. Next. هسه another symptom اللي هو الأنوركسيا فقدان الشهية. In a meta-analysis of 60 studies, 26.8% had anorexia as the most common symptom, and this accounted for difficulties with internal feeding. يعني هي most common symptom هي الأنوركسيا فقدان الشهية بحيث إنه حتى هذا البيشنت يحدث عندهم internal feeding كلش difficulty يعني بسبب فقدان الشهية بحيث ما تكون ياكلون and maintains of adequate nutritional status. Furthermore, individuals who later developed refractory pneumonia had a higher incidence of anorexia on admission يعني اللي يعني بعدين إنه يحدث عندهم pneumonia هم كلش يعني كانوا يتعرضوا إنه عندهم anorexia قوية جدا. Next. Diarrhea أيضا ذكرنا أن الأنوركسيا والدياريا هي تعتبر من الموست common symptom. Diarrhea has been reported in 2 to 50% of cases and was found to be more common in severe disease. النسبة معناتها تكون moderate هي 69.2% للسevere اللي هي 100%. Pathologists found 20% of their patients experienced diarrhea as a first symptom, while the rest is occurred up to 10 days after the onset of the respiratory symptom. يعني العلماء والباحثون مع الباثولوجيست إنه اكتشفوا إنه مثلاً 20% من البيشنت إنه هم عندهم الدياريا هي الفيرست symptom. بس إنه الريست يعني الباقي يعني عن 20% إنه تظهر عندهم أعراض الدياريا بعد 10 أيام يعني symptom على الدياريا. A majority of patients are reported to have had non-severe, non-dehydrating and low volume diarrhea. إنه حتى الديارة الموجودة هي تكون بشكل يعني non-severe وما يحدث جفاف وتكون بlow volume and illness showing improvement by the day 13 يعني بعد اليوم 13 ممكن إنه يحدث عندهم تحسن من الديارة. Next. Abdominal pain is found at lower rate than other GIT symptom. يعني من كل ال GIT symptom هي الابdominal pain نشوفها كلش قليلة يعني من مرضى كورونا. But was common among patients receiving intensive care unit ICU care يعني اللي عند العناية المركزية هذول أكثر الأشخاص اللي ممكن يكون عندهم abdominal pain. A minority of patients presenting with abdominal pain had an important abdominal cause. يعني إنه الأشخاص اللي ممكن يكون عندهم abdominal pain ممكن تكون متعلقة بأشياء أخرى عندهم هي فيعني هذا الشيء يؤدي إنه يكون عندهم abdominal pain مثل acute pancreatitis, acute appendicitis, intestinal obstruction, small bowel ischemia, sigmoidous ischemia, hemoperitoneum, hemopneumotonium or abdominal compartment syndrome. Pathologists described 7 COVID-19 patients who underwent the emergency surgical يعني وصفوهم إنه بعد ما أخذوا العملية الجراحية وصفوا يعني أخذوا يعني عينات وكذا من patient وعلى 7 من المرضى ويعني عملوا هالاكتشاف لهذا السيمتوم. Next. Other GIT manifestation. Prominent GI symptoms such as the body diarrhea are more common in those with severe disease. نحن ذكرنا إنه الدياريا والأنوركسيا هي most common symptom. بس إنه يعني من ناحية البلدي diarrhea من تكون كلش severe disease ممكن يكون عندهم body diarrhea. Constipation and hemorrhage colitis are other less common GIT manifestations. Endoscope evaluation carried out by the pathologist in a patient presenting with GIT bleeding associated with the COVID-19 showed multiple round herpes erosion and ulcer. يعني إنه الأشخاص اللي عندهم يعني كورونا يعني ممكن يكون عندهم GIT bleeding يظهرون هالأشخاص هالبيشنت إنه عندهم herpes erosion وعندهم ممكن ulcer تظهر عندهم تقرحات. Similarly, pathologists report ulcerative and ischemic changes in rectal sigmoidoscopy in patients with severe symptoms. فهي باختصار ممكن يكون نتيجة البليدنج إنه يحدث عندهم ulcer وhemorrhage and ischemic changes. Next. تكمل زميلتي ريم إن شاء الله شرح الموضوع.
نجي هسه على liver injury in COVID-19. Mild to moderate liver injury including elevated aminotransferases, hypoproteinemia, and prothrombin time prolongation has been reported in the existing clinical investigation of COVID-19, whereas up to 60% of patients suffering from SARS had liver impairment. The presence of viral nucleic acid of SARS in liver tissue confirmed the coronavirus direct infection in the liver, and percutaneous liver biopsies of SARS coronavirus show conspicuous mitosis and apoptosis along with atypical features such as acidophilic bodies, ballooning of hepatocyte, and lobular activities without fibrin deposition or fibrosis. يعني وجود الحامض النووي الفيروسي للسارس in liver tissue يأكد، يعني راح يصير إنه إصابة مباشرة باللايفر and يعني البيوبسي مال الليفر عن طريق الجلد of SARS تظهر إنه conspicuous mitosis and apoptosis موت الخلايا المبرمج باللايفر along with atypical features. راح تطلع إن acidophilic bodies ballooning of hepatocyte مثل تضخم يعني خلايا الكبد and lobular activities without fibrin deposition of fibrosis. It is believed that SARS-associated hepatotoxicity may be likely with viral hepatitis or secondary effect associated with drug toxicity owing to high dose consumption of antiviral medication, antibiotic and steroid as well as immune system overreaction. يعني إنه يعني سمية الكبد اللي راح يعملها السارس إنه نتيجة راح تعمل لنا فيرال هيباتيتس يعني التهاب الكبد الفيروسي، أو نتيجة تأثير سمية الأدوية اللي راح ناخذها اللي هي مال كورونا فيروس اللي هي الأنتي فيرال أو ستيرويدات as well as immune system overaction. However, little is known about COVID-19 infection in liver. هسه نيجي على treatment for GI manifestation of COVID-19. There are currently no approved treatment recommendation for GI manifestation of COVID-19 except for symptomatic and supportive care. يعني حاليا ماكو إنه دواء معتمد باستثناء إنه symptomatic and supportive care اللي هي العناية الداعمة يعني العناية الشخصية. The COVID-19 is currently being treated with antiviral agents that are under experimentation for effectiveness. الانتيفيرال اللي هي these agents include الكلوروكوين هيدروكسيكلوروكوين، الريميسفير اللي هو novel nucleotide analog، اللوبينافير، ريتونافير بروتيز inhibitor اللي هي and tocilizumab اللي هو interleukin 6 inhibitor. Each of these agents was shown to be effective against SARS-CoV-19 in pre-elementary in vivo and vitro studies. يعني هاي الانتيفيرال انتيبيوتيك إنه هي فعالة حاليا بالمختبر وبالجسم البشري. However, further human clinical trials are needed to assess the effectiveness of this agent. يعني العديد من الدراسات نحتاج حتى نثبت فعالية هذه الأدوية. Therefore, the medical community presumes that the same overlap might exist to counteract COVID-19 too. As of today, preventive measures اللي هي washing hands, social distancing, avoiding crowds, etc. remain the only effective method for reducing the spread and severity of COVID-19. يعني هي هاي الإجراءات الوحيدة اللي تقلل من الإصابة بالكوفيد-19. هسه نيجي how to protect yourself and others اللي هي يعني نفسها تقريبا الوقاية نفسها wear a mask, stay 6 feet away from others يعني لبس الماسك ويعني الابتعاد 6 أقدام عن الآخرين. get vaccinated اللي هو اللقاح. avoid the crowds, cover coughs and sneeze, clean and disinfect, monitor your health daily and wash your hand often. Last but not least, an ounce of prevention is worth a pound of cure. Thank you for your attention.
Thank you. Thank you very much. Group الأول اللي هو نبأ وتقوى وريم، تسمعوني؟
إيه دكتور نسمعك، موجودين معك.
Thank you very much for this very nice topic presentation and language. Actually يعني I'm proud of you. صراحة كلش فخور بكم.
Thank you دكتور.
صراحة المعلومات بديعة، وأنا البيحة قريتون الموضوع يعني كثير من الأشياء احنا ما نعرفها. يعني يعني we didn't know those informations. Especially what happened in the GI tract by you know the mechanism is very important. The angiotensin converting enzyme هو هذا الجيم بلاير صراحة. أولا I have a question before me. Any one of your colleagues have question? من أكم من الشباب عنده في الاستفسار؟ No comment, no question.
لا دكتور، عاشت ايدهم واضح.
تمام ممنون. أنا I have a question for myself and for you. You said that the angiotensin converting enzyme, and it is a fact actually, present in the enterocytes. صح؟
نعم دكتور.
زين. فالسؤال يطرح نفسه، خاصة نحن قاعدين بالجي اي تي. جماعة السيلياك ديزيز شو يصير عندهم هذولي؟ طبعا أول حركة أو أول ديستركشن بالسيلياك هو يصير ديستركشن يعني للانتيروسايتس، تتفلش. اوكي، يعني الفيلاي كلها تصير يعني شلون تصير فلاتند وكذا. زين السؤال، هل ابو السيلياك ديزيز little bit protected against COVID مثلا؟ هو سؤال انا حقيقة ما اعرفه، بس هو جاب بالي انا اساله.
اعتقد دكتور انه يعني
موضوع مفتوح للنقاش يعني.
دكتور، هو مرض السيلياك ديزيز اصلا راح يكون عندهم تي سيل ميديتنج كرونيك انفلاميتري.
عفوا بنتي، سعيد عيدي كومنت.
هي من جماعة مرضى السيلياك ديزيز اصلا عندهم تي سيل ميديتد كرونيك انفلاميتري.
طيب،
واعتقد يعني راح يكون عندهم مقاومة ازيد لانه عندهم هاي الخلايا المناعية.
تقصدين من هالناحيه انت. انا رحت بغير اتجاه صراحه. طبعا هو هذا موضوع مفتوح للنقاش يعني. انا رحت بغير موضوع باتجاه انه كانما الانجيوتنسين كونفرتنج انزيم اللي هو موجود داخل الانتيروسايت الانترابيثيال يعني سيلز ماكو اللي موجودين، يعني بالتالي راح يصير ديستركشن. فهل انه هذا نفسه هذول الريسبتور راح يصير لهم ديستركشن ولهذا يكونون هذول السيليك مثلا يعني اقل عرضه؟ ما اعرف، هذا سؤال طبعا ما اعرف، اسالوا بينه ويعني اهل الباطنيه او شيء فقط لا اكثر. ما عندي كومنت، ما اعرف.
تمام دكتور.
Okay, thank you very much for this very nice presentation, and we will shift to the second group. عبد الرحمن سعد وتقى عبد الله ورفع البرهان, the genetic aspect of colorectal cancer.
نعم دكتور.
تفضل عبد الرحمن، تفضل ابني.
ظاهر يمكن الشير؟
اي نعم ظهر.
واضح عبد الرحمن جدا، عشتي لك.
Good evening, our dear lecturers and colleagues to our seminar. I hope you get. I wish you listen to our seminar, and I hope you get some benefits from it. Let's start with our seminar. It's called the genetic aspects of colorectal cancer. The first slide of our seminar we will be listing our content. We will start with a short and simple introduction, then we will shift to the histopathology of the colorectal cancer, risk factors, then the pathophysiology, polyps and their types, diagnosis and their techniques, screening and prevention, and finally, we will end our seminar with a simple quiz of 2 questions. I hope you listen to our seminar. Colorectal cancer is the second and third most common cancer in women and men. Reasons explaining this increased incidence include population aging and the preponderance of poor dietary habits or majority of poor dietary habits, smoking and low physical activity, and obesity in Western countries. The histopathology of colorectal cancer, we will start as usual grossly. What we will notice grossly, we will see colorectal carcinoma can be exophytic mass or deeply infiltrative ulcers, okay? The exophilic lesions are more common in the proximal colon, and they appear as bulky polypoid mass with rolled edges that are clearly demarcated from the adjacent normal mucosa. It will be appearing as a fungating mass from the lining, from the surface mucosal lining of the intestine. As we know, the normal tissue of the colon is composed from the mucosal epithelium, which is the surface, and then the submucosa, and the inner layer will be the muscularis layer. At early adenoma, we will see the cells, the neoplastic cells will be accumulating on the surface of the mucosa. In the intermediate adenoma, it will be forming the round exophytic masses, and the late adenoma also will be bigger in size. All that are limited. But when we metastasize in carcinoma, as we see in the submucosa and the muscularis layers, this will be the most dangerous one, which is the carcinoma. Macroscopically, the surface component may be ulcerated or show papillary or villous architectures. Residual adenoma is often present at the edge of the tumor. The columnar cells have pseudostratified vesicular nuclei with one or more punctate nuclei. An inflammatory infiltrate of lymphocytes, mostly T cells, of course, plasma cells, histiocytes, and dendritic cells is commonly present in the stroma. The glandular lumen commonly show dirty necrosis consisting of necrotic cells, cytoplasmic fragments, nuclear debris, and fibrinous material. Risk factors. What are the risk factors? Okay. Both environmental and genetic factors are important in colorectal carcinogenesis. It's not only genetic factors, it's not only familial, mostly is environmental. So environmental factors account for the wide geographical variation in incidence and degrees in risk seen in migration who move from high to low risk countries. Dietary factors are most important, and the most important is dietary factors. Genetic factors play an important part in the etiology of colorectal cancer. The majority of colorectal cancer, as we said, is sporadic, and approximately 3/4 of patients have a negative family history. That means 3/4 of patients are as a result of environmental factors. Okay. In most Western populations, the average lifetime risk for colorectal cancer is in the range of 3 to 5%. This risk almost doubles in individuals with a first-degree family member with colorectal cancer who was diagnosed at 50 to 70 years of age. The first-degree family member, as we know, is uncle, aunt, father, mother. No, uncle and aunt, not first-degree family members. Father, mother, brother, sister, and children are the first-degree family members. The risk triples if the first-degree relative was less than 50 years of age at diagnosis. As we said before, 3 to 5% is the risk, the total risk of colorectal cancer. But if we have a first-degree family member, the risk will be double. If the first-degree family member was less than 50 years, this risk will be tripled, unfortunately. Other factors like a chronic colitis due to an inflammatory bowel disease is also associated with increased risk of colorectal cancer. This increased risk in the presence of affected family, at least in part, reflects low penetrance genetic factors. We know what's low penetrance genetic factors. Accordingly, positive family history has a role in approximately 15 to 20% of patients with colorectal cancer. So it's important. Genetic factors are important, but are not the first causative of the neoplasm. Okay, pathophysiology. my colleague Rafael will talk about it.
Thank you, Abdurrahman. So now I'm going to talk about the pathophysiology of colorectal cancer. Colorectal cancer development results from the accumulation of multiple genetic mutations. There are also associated epigenetic influence, such as microRNA expression signature and potential influences from non-coding genetic variation. Currently, there are three main pathways of genetic instability, and each is associated with histological, clinical, and prognostic parameters. So now I'm going to talk about the three main genetic instability, which is going to cause the colorectal cancer. As we all know, cancer, all type of cancer caused by a mutation. So the mutation pathway in this disease is going to be listed below as first, chromosomal instability. A mutation or deletion of portion of chromosomes arises with loss of heterozygosity and inactivation of specific tumor suppressor genes. There are multiple tumor suppressor genes. I'm going to list after these slides one of them, and you will see it. In loss of heterozygosity, one allele of a gene is deleted, but gene inactivation occurs only when a subsequent unrelated mutation affected the other allele. So the deletion of one gene is not enough to cause the disease. It has to be a subsequent unrelated mutation affected the other allele. A chromosomal instability occurs around 85% of colorectal cancers. Second, I'm going to talk about microsatellite instability. This involves germline mutation in one of 6 genes encoding enzymes involved in repairing errors that occur normally DNA replication, DNA mismatch repair. These genes include HMSH2, HMSH6, HMLH1, HMLH3, so on. They are actually 6 genes, as we said, which is gonna happen. What's gonna happen is a repairing error gonna occur in these genes, which will have a mutation. Replication errors accumulate and can be detected in microsatellite of repetitive DNA sequence. They also occur in important regulatory genes, resulting in a genetically unstable phenotype and accumulating of multiple somatic mutations throughout the genome that eventually lead to cancer. Around 15% of sporadic cancer develop this way, as do most cases of hereditary non-polyposis colon cancer. CpG, island methylator phenotype. This phenotype is found approximately 20 to 30% of colorectal cancer. As a result, in white separate gene hypermethylation, the result is functional loss of a tumor suppressor gene. As we talked, the first and the third causes of colorectal cancer is going to be caused by a tumor suppressor gene inactivation. One of these tumor suppressor genes, which will be inactivated in colorectal cancer, is APC, which is adenomatous polyposis coli. It is a tumor suppressor protein, which means that it keeps cells from growing, dividing irregularly. It helps control how often the cells divide, how it attacks to other cells within the tissue, and whether a cell moves within or away from a tissue. Well, the mechanism of this protein, well, actually, it's complicated. I mean, there's a lot of details that I've read in a couple of books, but this is a short line of the mechanism of this protein. It involved in beta-catenin signaling pathway. It binds to beta-catenin and allowing beta-catenin to translocate to the nuclei where it upregulates the expression of many genes. If the beta-catenin, can you go back, please, Abdurrahman? if beta-catenin was mutated, APC protein cannot bind to beta-catenin. So this is the mechanism of APC protein. Next slide. The most common syndrome, okay. Now I'm going to talk about Lynch syndrome. It's a very important syndrome in colorectal cancer.